Hi, my name's Dr. Schuljak, and today I'm going to be talking to you about spay and neuter care after the procedure for either your dog or your cat. The main things that we're going to focus on here today are the incision care, what they can eat and drink when they get home, medications your pet may go home with, exercise activity restriction, and then monitoring and what we should be worried about at home. So first things first, incision care. Your pet does not have any external sutures, so there's no need for a suture removal for them. We'll want to make sure that the incision stays nice and clean, dry, and monitor for discharge. It's normal for them to have discharge from their incision for the first 24 to 48 hours, but anything after that, please let us know. You can always send us a picture and be happy to take a look at it for you. Your pet will go home with a cone or an e-collar here today. What that means is it's a tool to help us prevent them from getting at their incision, licking it excessively, opening it up. So I do recommend keeping that cone on for the next 10 to 14 days, making sure they can't do that. Next thing we'll talk about are food and drinks that they can have at home. So for when they go home that day of, they are allowed to have unlimited access to water as long as they're not showing any signs of nausea for us. Main things you want to keep an eye out for would be excessive drooling, lip licking, or hopefully not, but vomiting as well. If any of those occur, I do recommend holding off on giving them water until the following morning. Other thing that we can do for them is they can have dinner that night as long as they're, once again, not showing us any signs of nausea for us. Next thing we'll talk about medications. So typically for a spay and neuter procedure, your pet will go home with an anti-inflammatory medication, either called carprofen or meloxicam. This medication helps decrease the inflammation and pain associated with the procedure when they go home. Other medications that your pet may go home with include gabapentin, which is a pain medication, a mild sedative. And then the last one would be a plain, I would say more regular pain sedative medication called trazodone. And that medication can help make sure they stay calm, activity restricted for the following 10 to 14 days after the procedure. Next thing we'll talk about, exercise restriction. They do need to be exercise restricted for the next 10 to 14 days while their incision heals. Main concerns that we have with increased activity can be dehiscence or breaking apart of the incision where they had their procedure done, and then also infection at that site if it is overly mobile. So to help us prevent that from occurring, please only leash walk your pet if it's a dog to go to the bathroom, so no running around the backyard. And if it's a cat, I recommend trying to contain them into a room or an area where they're not allowed to jump on and off higher objects. For the day of the procedure, they're most likely going to be pretty groggy from the anesthesia itself, so make sure you keep an eye on them, making sure they're not running up and down the stairs, jumping on off higher furniture, or even just going up the stairs in general, as they're going to be a little bit more uncoordinated than they normally are. Last thing that we'll want to keep an eye out for at home is monitoring, what that looks like for the next 10 to 14 days. As I said before with the incision, you want to make sure it stays nice and dry, clean, without a lot of discharge after the first 24 to 48 hours. Other things we'll want to keep an eye on certainly are nausea, vomiting, and diarrhea, which are some of the things that we can see after the procedure for them. So certainly keep an eye, making sure that they return to normal appetite, they start eating well for us, they're drinking well for us too. And if they are not, please let us know. We'd be happy to chat with you about what next steps look like for your pet. Overall, that is my recommended routine that we do for all of our spay and neuter procedures here at Queen City Animal Hospital. And as always, you can always contact us at 704-703-1414 if you have any questions. And you can also email me at my personal work email, which is Dr. Schuljak, SCHULJAK, at queencityah.com. Thank you.